All right, so great. So today, I know this week you guys worked on dentistry, is that correct? Dentistry and imaging, is that right? Am I way off?
I think dentistry.
Dentistry, okay. And then did we do dentistry at one point already?
I don't recall going over it.
Okay, I know I went over it in one course before and it was like, I went over it too early for them and I was like, whoops, I shouldn't have done that. So I just want to make sure that I didn't go over it with you guys yet. So, all right, cool. So yeah, dentistry and imaging is what we should be going over today. Obviously, if there are things that we need to go over like from weeks prior, we absolutely can go over. So like if there are questions that you guys have for emergency critical care or reproduction, nursing stuff, fluid therapy, lab stuff, anything like that, we can absolutely go over that stuff. But obviously imaging and dentistry, it seems like there's always questions in regards to that stuff. So yeah, let's talk about that. Any questions that you guys have first off, or maybe that you came across? Everybody understood it all? You're like good to go? Anyone feel like still uncomfortable about dentistry or imaging?
I'm just having trouble trying to figure out the different angles for that you need to take for the imaging.
For dentistry?
Yes.
Okay, dental imaging. Okay, perfect. That's pretty normal, so that's good. And that comes too with practice, but we'll kind of go over that for sure. So, and then anything else? Oh, so we'll go over that. Everybody understand like Trident system? Like numbering of teeth?
Do you have any sort of like mnemonics to help me remember? Because like I remember some, I'm having a little trouble.
Yeah, like how to.
I'm pretty weak with dentistry.
Okay, so yeah, we'll go over the Trident system, and just like how to remember like numbering of teeth, because obviously cats and dogs are going to be a little bit different because cats are missing some teeth. And then also we have to know puppy and kitten teeth too. So those guys are a little bit different as well, and how to do those. Locational terms, yes, we need to know that. Very good. Okay. Yeah, how to remember that stuff. Very good. All right. So, let me. I'm going to share my screen with you guys. Can you see my screen? You guys can see everything, right?
Yes.
Okay, perfect. All All right. So I'm not going to go over this whole entire PowerPoint, but I am going to go through like some of the dentistry aspects of things. So like stop me if you have questions or something doesn't make sense, or you might have learned something different, or something that you learned, you have a better way of remembering how to do something too. So that might help people. So obviously like we have to know, especially with like dentistry, like our anatomy of teeth, our numbering of teeth, any type of disease progression, right? Then our instruments, you guys all know your instruments too. Yeah. And then what they're used for, right? So we're not just like using like our scaler and then polishing and then we're done. Like we have actually hand instruments that we need to use. And then obviously the whole dental cleaning process, probing and charting. And so that's really important. We need to be able to have some sort of medical records that go with it. And then client education is really important too. So when owners do a dental or a cohat, as we call it, they need to know like what they're actually paying for. So by doing client education, this is going to help them know exactly like, hey, this is like a really big deal, right? That we're getting something with our money's worth, right? So anything that we can provide them with client education is great, right? So if you are taking a before and after photo, if you're providing them with some pictures of the radiographs that you guys are doing, that's fantastic. So that's really great. And then also sending them home with education material, like what to do, you know, throughout the next year or so that they're there would be really great. So directional terms, right? So obviously this is the maxilla and this is the mandible, right? So if we are going towards the cheek, right? That means that we're going buccal, like it's more buccal in that term, okay? So we're on the buccal side. So if we are right here, this is buccal, right? This is the palatal side, right? So if you're like describing something to your doctor, you're describing something in the medical record and you say, oh, there's, you know, a fracture on the tooth on the buccal side of the tooth, right? That would be how you would describe it if it's right here. If there's a fracture right here of the tooth, then you would say it would be on the palatal side of the tooth, right? Or say there's a mass somewhere, right? Say there's a mass right here by that canine. It would be on the palatal side of that canine, right? Now, if you are talking on the front incisors, you have like your lips essentially, right? So the labial side. So that's another term that you can use. So you can also say labial as well. All right. So on our bottom, so our bottom being our maxilla, or I'm sorry, our mandible, losing my mind, mandible. We are dealing with our tongue, right? So we're just missing the tongue here. So that's why we have lingual. So meaning if we have our fracture right here, like on this side of the tooth, it's going towards the tongue, right? So that would be lingual, right? Because that's lingual means tongue, all right? And then if you have it on the other side of the tooth, again, we're going towards the cheek. So that's buccal, right? Again, labial is lip. So again, you're going, if it's on this side of the tooth, sorry, on that side, it would be lip. So labial. Make sense? All right. Okay, so Then we have directional terms. So just like you guys have directional terms like with cranial and caudal, we also have directional terms in the mouth called mesial and distal, okay? So mesial means that you're going towards like the midline of the arch of the mouth, right? So you're going mesial to like this midline of the mouth, right? So, and distal meaning you're going further away from that arch of the mouth, okay? So, mesial is going towards this midline of these incisors, and then distal meaning we're going further away. Okay, so that's how we would describe that. All right. Any questions on that? All right. So we also can use directional terms called occlusal, rostral, and caudal. Okay. So what's occlusal mean? What does it mean when we occlude something?
To like overlap something, or
Yeah.
Okay.
Very good. Yeah. So it's where we're biting down, right? So it's the part where we're biting down, or yeah, like you're so occluding, right? You ever hear like, oh, we have a occluded line? Something's like your fluid pump is occluded, right? It means that it's clamped, right? So occlusal means like the biting down part, right? The clamping down of your teeth. So this essentially means that it's the biting surface of the tooth of usually like your molars or premolars or something. So these surfaces right here on the top of the teeth. Okay, so the occlusal surfaces. All right. How about rostral? Where is that? What's that directional term?
Towards the nose.
Towards the nose. Very good. Yeah. So we can also describe things going towards the nose, that type of thing. How about caudal?
Like towards the tail end or the back.
Towards the back end. Yeah, absolutely. So there's a lot of different ways that we can describe things, right? To define like where something may be in a mouth, but we have to be able to like try to define exactly where something might be within a mouth, rather just being like it's on the right side of the body, you know, like that doesn't give us an exact location, right? Very good. So how about a normal occlusion? What does that look like for our pets? They have what type of occlusion? Minus our brachiocephalics. They don't have normal occlusions. We want to see this, right? So what is that? What do we call that? It's right here. It's a scissor bite. So it's like scissoring down, right? We don't want to see like teeth that are actually like touching each other because they're going to actually like rub on each other, right? So what is that called when teeth are hitting each other and causing what? When teeth like hit each other and like grind on each other, what is that called?
Is that like malocclusion?
Okay, so it can be, it's a malocclusion. Yeah, it's a malocclusion. But what happens when they hit each other and grind on each other or wear each other down? What is that called?
Is that attrition?
Okay, yeah, attrition. Very good. So, great. So our anatomy of a teeth, right? So when we look at our anatomy, we have our crown of our teeth, right? So that's the part that we can see, right? So this is like how we have to describe this to owners is that, yeah, we can see the crown of the teeth, but we can't actually see the root of the teeth. So the roots go really far into our teeth. So especially the canines are really hard, obviously, to take rads of because we're actually taking rads, you know, really far back onto these teeth. The enamel of the teeth, right? So the enamel is the coating of the tooth itself. All right. So foramen, what's foramen?
That's like a cavity.
Okay. So what
Like
would be the
like
foramen here?
Oh, I don't remember what it's called. I see them. There's the little holes down at the bottom
Okay.
jaw.
Yeah, so here, right? So these are where we can give like our,
You do dental blocks in those, right?
exactly, we do our dental blocks here, right? So absolutely. How about furcation? You can see it here because there's no gums and stuff, but what's furcation?
Is it like where the middle, like you can stick an instrument through?
Very good. So there's stages, right? So like you have stage 1 where you start seeing, you know, part of this root here, right? And then stage 2 and stage 3. Stage 3 is where you can literally stick like a probe right in between these two roots, right? So you have recession of the gums, and then you can see this, you could stick that instrument right in between there, right? So furcation is actually seeing this right here, or this right here, or this right here, or right here, right? How about juga? What's that? Anyone learn what juga is? It's the connection of the teeth. So periodontal ligament. So everybody knows what the periodontal ligament is, correct? So what is how do I talk about the periodontal? periodontal ligament does what, essentially?
Don't the doctors cut through it in order to remove the tooth?
Yeah, like they have to either kind of cut through that, or they have to stretch out that periodontal ligament, right? In order to remove the tooth, correct? Sometimes it's easy, you know, if the tooth is really diseased, or if the tooth is not really diseased, and say the tooth, you know, is fractured somehow, and they have to like take out a pretty healthy tooth. It's a pain in the butt, right? To like stretch out that periodontal ligament. So, yeah, it can be difficult. So, but yes, it's really what holds that tooth in really well, right? So yes, I have to stretch that out. So that is what they use their what instrument to do? What instruments do they use?
Is it the elevator?
Yeah, they're elevators, right? So all different types of elevators that they use. So depending on what tooth, they may use, you know, some of the smaller elevators, like their size 1 or 2 for like incisors, or like their little tiny premolars, say size 3s for some of the little bit bigger premolars, size 4. So it goes up from there, 4, 5, 6, 7, 8 for the bigger ones. So very good. Dentin. What's dentin? So you have your enamel of the tooth, right? And so right underneath your enamel, you're going to have your dentin. So the dentin is the pretty sensitive part of the tooth, right? The enamel is not necessarily as sensitive, but the dentin is pretty, that's the sensitive part. How about cementin? What's the cementin? Where is that located?
Is that underneath the dentin?
Yeah, so you have, okay, so you have the enamel, right? So you have enamel here, then you have the dentin. Now cementin, just think of cement. So if we're like building a fence here, we put in cement posts down here, right? So we're cementing, oops. So we're cementing it in. So the cementin is right here. So it cements it all in. So the cementin lives in here. So it's cementing that tooth in. All right. Now the cementin enamel junction is just this junction right here. It's just where that junction lives. Okay. How about the root of the tooth? Like, where's the root of this tooth? Or how many roots does this tooth have?
2?
This one?
I think so. Is it 3?
Okay, so this tooth has 1 root.
Oh, I see now. Sorry.
Yeah, so this tooth has 1 root. How about this one?
That one's 2.
This one's 2. Good. So you have 1, 2. Awesome. All right. And then how about the apex of the tooth? Where does that?
The tip of the tooth?
Good. So apex being right here or right here?
It's the exposed part, I think.
It's actually right here.
Oh, okay. So it's
Yeah.
what's under the gum line.
Yeah. So down here, it's apex. Absolutely. Good job. All right. So we already did that part. I have two of those. Okay. So the trident numbering system. Okay. So this is the 3-digit system, right? It represents each quadrant. Okay. So the good way of remembering this, I don't know if you guys learned it this way, is if you take your left hand and make a C and put it up to your mouth, go like this. And then you just go 100s are here on your right uppers, 200s are on your left uppers, then you go down to the bottom, 300s are on your lower left, and 400s are on your right lowers. Okay, so that's the easiest way. Now, how do you do puppies and kittens? So deciduous teeth. What are puppies?
Oh, that's 100, or is that? I think that's 500. I don't remember.
Okay, so yeah, so 100, 200, 300, 400, and then it goes 500, 600, 700, 800. Yeah, absolutely. So it's super, super easy. Like you just keep counting, right? So it just represents those teeth. So how you do that is you have your incisors here are 101, 102, 103. Then you have your canines, 104, right? And then you have your premolars and then your molars, right? So there's this rule, right? Rule of 4s and 9s. So did you guys learn about this rule? Rule of 4s and 9s.
I remember hearing something about it, but I don't remember what the rule was.
Okay, good. Okay. So anybody else hear of it?
I only heard about the 4s being
Okay.
the canines.
Okay. So yeah, the rule of 4 is that right. Every something 04, right? So whether it's 104, 204, 304, 404, whatever, is going to be a canine tooth, right? And then every 9, so 109, 209, 309, and 409 is always going to be your first molar. Okay. So this is really helpful for when you're dealing with cats or animals that have like missing teeth, because that way you can count backwards. So if you have, because as you guys know, cats are missing certain premolars. So you can go, okay, here's my canine, and then here's my first molar. So I could go, okay, I have my 109, and then I could go 108, 107, 106, and then we're missing, you know, a tooth or something like that. So that way you can kind of visualize like, all right, here's a molar, and then counting that way. So just always remember like, okay, my canines are 4s and my first molar is going to be a 9, right? So remember, of course, the dental disease like bacteria can build up pretty fast, building plaque, and we can scrape away it within the first 48 hours. But after that, like tartar starts building up. So that's why it's important that we recommend that they brush their pet's teeth every day. This is why we obviously brush our teeth every day. There's a lot of different products out there to help brush their teeth, but or even, you know, they have like those gauze wipes that they can use that just like, it's like a chlorhexidine type of rinse type of thing that they can like just scrape away at their teeth too. So even doing something like that is better than nothing, but trying to get them to do that stuff too. So how many of you currently right now brush your animal's teeth every single day? Melody does. Okay, so she's probably one of the few, right? But so it's really hard to obviously get people to do that overall, right? So anything that we can give them, rather than just saying, hey, brush your teeth every single, or brush your animal's teeth every single day, we need to give them multiple different options, right? So if you can, option A, brush your animal's teeth every single day. Option 2, do X, Y, and Z. So if they can do the wipes, that would be great. If you can do some type of chewing aspects of things, that would be awesome. Like, you know, this is the best option, but here are some other things that you can do too. So that's where client education comes in. Obviously, bacteria and other things start to grow in areas that don't get a lot of oxygen, it's moist, and there's not a lot of light. Well, guess what? That is where our mouth is. So that is why it's really important that we keep that area clean as much as possible. So here's what a lot of the teeth we see, right? They look like, or worse, right? So after 10 days, plaque really starts to build up and harden and becomes calculus. So this is stuff that we really can't get off. And so, you know, owners might want to start, you know, brushing teeth at this point. Well, we can't get this calculus off. We can't brush that off at that point, right? So this is why we need to do dental cleanings more frequently. So even if we see like a small amount of calculus, it's still going to create gingivitis, right? So we still need to do those dental cleanings quite frequently. And then that bacteria can get into our circulatory system, because why? How can it get into our circulatory system?
Bacteria gets into gingivitis. So oftentimes when we have gingivitis, we'll see blood. So where there's blood, there is room for bacteria to go and get to the vital organs.
Yeah, definitely. Yeah. So your gums start bleeding. Obviously, this is high in, you know, you have tissue right here. Obviously, it's going to start bleeding and be really irritated. So that's how it gets into your bloodstream. Okay. So in cats as well, we see feline malocclusions too. So that's important to note. Also, we'll see retained deciduous teeth too. So with cats and dogs. And so that's also important. Why do we sometimes see some malocclusions in some cats? What are some common things why we'll see some malocclusions? Especially in like stray cats.
They're breeding with each other, so the genetic is just super screwed up. So you'll be more apt to have problems, possibly.
Maybe. Some kind of genetics, yeah. But what are some like common reasons why, especially with like stray cats?
Oh, they fight?
Potential fighting, sure. I mean, I'd have to fight with something pretty big.
Nutrition.
Could be nutrition, yeah, especially if it's like, you know, you have bone loss or something like that. But what else? What happens to some stray cats?
Oh, hit by a car.
Yeah, right. Yeah, hit by a car and they break their jaw or something, and then it heals or whatever, right?
Mhm.
So, so I've seen this quite frequently with, they'll come in, they'll be super skinny, and we're trying to figure out why they're super skinny, and they come in with, you know, these malocclusions where you'll see this canine is shifted over, and you can see there's some attrition here, and whatnot. So, and it could be due to the fact that there was some sort of injury. You know, we can't say yes, they were hit by a car unless, you know, we've seen it, but most likely it was something to that extent, like they got into some sort of big injury. So, and then of course, we'll also see some progression of dental disease too. So, you know, some really bad dental disease in cats, especially, you see a lot of bone loss as well. So it can be pretty nasty. Okay. So we talked about the breed standard of an underbite, right? So sometimes we'll see just underbites in general and just some dogs that it may not necessarily be breed standard, but in some animals that is breed standard, right? So just as a note, some other malocclusions that you might see. So some of these are things that we absolutely need to fix because you might have some areas where you'll have some holes noticed in their palate. So these are things that we may have to fix as well. So like in this dog, he has a malocclusion where his canine teeth were too far in, right? So he was having some, biting going on into his soft palate, right? So like we said, retained deciduous teeth. So how many of you have seen retained deciduous teeth before? Some people, maybe. How many of
No,
you
I haven't seen it yet.
Not yet? Okay, good. You will, I'm sure.
My parents' dachshund retained her deciduous teeth for a long time.
Yeah. So I have a Pomeranian who had like 5 or 6 retained deciduous teeth. Like he had like little shark teeth, like this down at the bottom. So yeah, we had to take those out. Now there are some people out there like that think that it's cute to keep those, right? And there's some breeders who are like, they want to actually like breed that, and they think that it's like, I don't know, good. But why is that not a good thing?
More teeth equals more surfaces for bacteria and plaque equals really bad periodontal disease.
Yeah, absolutely. So yeah, and they're moving those other teeth out of the way, right? So we're creating malocclusions for those other teeth. So we want to make sure that those teeth are coming in correctly, right? So, it's most commonly seen in our canine teeth because our canine teeth come in last. But we can see it in like basically any teeth, like even your incisors and stuff. But we want to take those out as much as possible. Okay, so when we are doing a dental treatment per se, we don't really call it a dental, right? Yes, I will catch myself calling it a dental all the time, and I'm like, oh, we shouldn't say that. But it isn't actually called a dental, right? So, and it's not a prophylaxis, because what does prophylaxis mean?
Prevention, I believe.
Yeah, it's like a prevention, right? But are we preventing anything?
Not really.
Yeah, it's like we're doing this after the fact, right?
Mhm.
Because like gingivitis and all of that has already started taking place. Like all of this stuff is already taking place. So they are now calling our dental treatments cohats. So you guys have learned what cohat is, correct? Yes?
No, only with you.
Oh, okay. I'm like, yes, you have. So it means complete oral health assessment and treatment. Okay. Some people will call it oral assessment and treatment. So you may see that too, but standard wise, it's called a cohat. So you may still see people or hear people say dental, just like myself, just like randomly say dental, but really gold standard wise, we say cohat as well. Okay. Everybody learned cohat?
No, when I went to school, they were still calling it dentistry and prophylaxis. This was like 2 years ago when I started the program. Like 3 years ago when I started the program. I haven't heard that from you.
Wow. Okay. Yeah. So, So if you guys like when you go into practice, like truly, it's like a cohat procedure, and really like we say cohat because of all of the stuff that you guys put into your dental procedures, right? So if you're thinking of a dental treatment, right, that just means like you're just doing like dental scale, like I guess a dental scaling and polishing or whatever. But if you're doing a complete oral health assessment and treatment, that means like you're assessing the entire mouth, right? And then you're also treating it for whatever you see, right? So it kind of gives a better description of what you're actually doing. All right, so what should we be wearing during our procedure? So I will tell you that this person's probably not wearing everything that they should, but that's okay because we're gonna fix that.
I would add
You should wear a
slab.
mask, a dental shield.
Yes,
Gloves.
so yeah,
Everything that you have on your slide, except I would also add lab coat.
okay,
So that when you go see other patients, then if you're not able to change, then you don't see other patients with all that mouth bacteria on you.
right, perfect. So minimum PPE, right? You have gloves, mask, goggles, or a shield, like you said, right? So she has glasses on. So this is always the thing I hear people say, well, I have glasses, so I don't need to wear, goggles or anything. Stuff can still fly, like bacteria is still gonna be flying everywhere. So your glasses do not protect you from that stuff. Like it will just protect you a little bit, right, where your glasses are at, but it will not protect you completely. And I have heard people get pink eye, number one, from dental procedures. I have also had someone say that they had like calculus literally fly straight into their eye and cause abrasions on their eye. And then they get pink eye from it. So super easy to put on some goggles or a face shield for your cohat procedures. Also, why would we wear like a surgery cap or a bouffant cap or something like that? Like, why is that important? Like we do it for surgery. So why are we doing it for dental procedures? Especially for dental cleanings, I should say. And like a lab jacket or gown, or in this case, she has scrubs on. You could wear scrubs as long as you just change out of your scrubs afterwards and put on new scrubs. Like that's fine. But like, why is that important?
Sorry, what was your question?
Prevents contamination.
Yeah, like you're going to be contaminated with all of that bacteria, nasty stuff, which you have no idea what is in that mouth, right? Like absolutely no idea. And then say you go and you finish your dental procedures for that day and you're going to see patients afterwards, right? And you go and see a brand new puppy or kitten or a sick pet, or you're even going home to see your own animals and you're going and sitting in your car and you're just filled with bacteria in your hair or on your clothes or whatever. Like, no, I don't think so. Like try to minimize that contamination as much as possible, right? That's what we're trying to do. So try to wear as much PPE as possible. So whether you wear a lab jacket, gown, just change out of your scrubs is totally fine. I tell people even like those groomer jackets, just put those things in because they like wick away water really easily. And then you can just wash them afterwards. It's nice too. But yeah, that's minimum PPE to wear. Obviously wear gloves because it's just gross to touch mouths without gloves. So. And then our common equipment. So these are what our power tools, right, that we use. So our scaler, right, is right here. So what's important to note about our scaler?
Is it you can only have it a certain amount of time on your tooth?
Right. So like, what were you guys told? How long to probably put it on a tooth?
10 to 15 seconds.
Okay. Yeah, I've heard anywhere between like 10 seconds. I've always said like I keep it on a tooth for about 5 seconds, but I think I'm just like weird like that. So and then I just kind of go back to it, you know, like I work my way down the mouth and then I just come back. So what else do you need to know about a scaler?
You have to keep like your water full so it doesn't get too hot.
Yeah, it gets hot, right? Because it's vibrating like really, really fast. So there has to be water coming out of it, right, to keep it cool. So there's a gauge on this guy, right? So this dial right here is a gauge. And if you guys have a machine that looks like this, and so if this gauge gets too high in this yellow, that means that you guys need to like give it a break and let it cool down. All right. So if you didn't know that, we just kind of keep a monitor of that. So, or change like some of your water flow in there or something like that to kind of keep it cool. Is that this is a gauge to kind of tell you like, hey, it's getting a little hot or it's, you know, working too hard. How about our low speed hand pieces? So this is a high speed, right, hand piece. Our low speed hand pieces are our polisher and root canal steps. So a polisher is this guy, right? So do you guys use a brand new tip for each patient?
You're supposed to, I believe.
Okay, yeah. So we have a brand new head and tip for each patient. And in this picture, they have like a big jug of prophy paste. But ideally we would have individual prophy cups, right? Do you guys have individual prophy cups for your patients?
I know some clinics do.
Okay. So what's the benefit of having individual prophy cups versus this big tub?
I'd say it's less likely to have cross contamination.
Good.
Like it probably like doesn't last as long because you're constantly like going in there.
Right. Okay. So yeah, we're gonna have less cross contamination, right? Because we have to go in here several times, and we're no matter what, we're introducing bacteria to it. All right. So if we have individual prophy cups, that's just for that patient, right? Now, why do people then get these big prophy jugs or containers?
I don't know. Is it because they think it would be less expensive?
Yeah.
To get on special?
Yeah. It's definitely a lot more cost effective for sure. Definitely is.
Probably more eco-friendly as well, because if you're throwing away little cups, maybe.
I don't think that people are thinking eco-friendly that much. No. But it is definitely more cost effective. But I mean, we're considering not that much. I mean, if it's in the grand scheme of things, it's not that much, you know, like especially for how much we're charging for our dental procedures, you know. So why do we polish? What's the deal with polishing?
Smooths out what the scaler like caused.
So the scaler does what?
Like it cleans and then it like causes like grooves on them too sometimes.
Yeah,
and the polisher comes in and smooths those back out.
absolutely. Absolutely. So yeah, the polisher is going to polish those little grooves out really well. So there's actually a bunch of different types of polishers out there that come in like fine grit or a little bit coarser grit and stuff like that too. So depending on if you work at like a dental specialty and stuff too, they may ask for different types of grit that you may get, especially if they're doing like root canals and stuff. So, but typically in, you know, if you're just doing regular like profies, then, you know, you just get your regular polisher. Now, anyone do fluoride treatment?
We do.
You do? Okay. So how do you do your fluoride treatment?
So we apply it at the end,
Mm-hmm.
and then we let it sit for like about a minute, and then we rinse it off.
Okay. So there are there's prophy paste out there that has fluoride in it. So you can also do that too, if you consider that. Yeah. That might help take one step out of your daily thing. And why do we do fluoride?
Strengthen the piranha teeth.
Sorry, strengthen the what?
Strengthen the teeth, as referring to piranhas as the puppies that are starting to have their adult teeth and are still chewing on things.
Okay, but what are we strengthening on the tooth?
The dentine?
No, not the dentin.
The enamel?
The enamel, good. The enamel, very good. So say they have, you know, like a fracture, or say we've created, right, these tiny grooves on a tooth because we have scaled the teeth, right? And then we polish them. We want to strengthen that enamel again, right? Yeah, we didn't really do that much harm to it, but we do want to strengthen it, right? So that's why we do some of the fluoride treatment, just to make sure we're strengthening it okay. And especially on our younger guys, we want to do it more as well because they're younger too, right? So that's something to consider doing as well. And then our high speed handpiece. So our drill that we use. So what do we use the drill for? What do you guys use your drill for, at least?
Our doctors use it to like remove teeth, to like cut them in half and then remove them.
Absolutely, good. So yeah, when we have, you know, teeth that are like multiple rooted teeth, right? It's easier to create like a flap on those teeth and then remove the tooth like one section at a time. So yeah, we can absolutely do that. Now, we also use our drill, like if you're doing root canals and stuff like that, we'll use our drill in that case. But, you know, unless you're working at a dental specialty or a doctor who's like really into dentistry, most of the time you're using your drill just to kind of help remove teeth. How about your three-way syringe? What is that? Most people don't call it a three-way syringe. We call it like something random. It's this guy here, our water and air. And it's three-way because we can do water, air, or both water, air at the same time. And then any of you guys have a light on either your scaler or your drill?
Never seen that actually.
Yeah, it's really fantastic to have a light on your scaler and your drill, honestly. So if you don't have one, obviously you have to pay additional for it, but it's really, really nice to have them. So you just talk to your company and ask for one. Okay, so our common equipment that we use, right, is our probe. So which one here is our probe?
The one by your.
So the first one, second one, third one, fourth one, fifth one, sixth one.
Third one?
This guy?
Yeah. Is it just me that's seeing red lines on the screen?
No, it's there.
Oh, okay.
I can't get rid of him.
Oh.
I wonder if hold on. I'll get it back.
It's okay. I thought my cat did it for a while. I was like,
There we go. Okay, so this third one here, right? So this guy, so the probe, what does the probe do?
You would measure your gingival focus.
All right, so we're measuring our gingival, like we're measuring for pockets, right? You're measuring for pockets, right? So you're probing for pockets.
Mhm.
So you're measuring for pockets. And so on here, you can kind of see there's like, it's measured in 3 millimeter spaces, right? So on these guys, typically you'll see like a silver spot and then a black spot, a silver spot and black spot. So the silver spot represents 3 millimeters, then there'll be a black spot that's 3 millimeters. So you'll go that way. And so essentially you're going around the tooth and seeing if there's any major pocketing around the tooth, right? So what is the normal pocket amount for a dog versus a cat?
Dog, I want to say under 0.3. And cat would be 0.1.
No, you sort of close.
0.2?
No,
like 1 to 5 for a dog, and then or 0 to 5 for a dog, 3 for a dog.
okay, close.
Is it 1 to 3 for dog and 1 to 2 for cat?
Okay, better. So yeah, we want somewhere less than 3 for a dog, ideally. And then somewhere or somewhere below 1 for a cat. So good, very good. Obviously, if we have a dog who has 4 millimeters or even 5 millimeters sometimes of a pocket, that doesn't mean, oh my gosh, we're gonna take out that tooth, right? That means like we have some gingivitis and we might need to, do some good cleaning there and watch the tooth potentially, and that kind of thing. Like if it's 8 millimeters around the entire tooth, then we may have to remove that tooth, as that kind of thing. So it just kind of depends. How about the Explorer?
You explore for dents and pockets and unusual things.
Okay, so the Explorer's on this end, right? So we're not looking for pockets because that's what the probe does. But the explorer's right here. So what does the explorer do? It's pretty like sharp and pointy.
Looking for holes or like cavities in the teeth.
Okay, good. It's looking for those sticky spots, right? So remember, like enamel is not sticky, right? Our enamel's hard. So if our enamel is kind of wearing down, so we get to that sticky spot, we're like finding for any kind of cavities, that kind of stuff, right? Now, do animals typically get a lot of cavities?
Depends on their diet, I'd say. Or the way their teeth are made.
Maybe, yeah. I mean, typically, no, they don't get a lot of cavities, but with fractures and stuff, you know, we could be able to find some of those sticky spots too. They might have small fractures or stuff like that too. So that could be. Also, like root exposure, stuff like that, we'll be able to see that too. So that's kind of what we're looking for. How about hand scaler? Which one on here? Oh my gosh, I don't even have a hand scaler on here. That's not fair. Or a curette. What is the difference between a hand scaler and a curette?
A curette.
They
Would
have
that
those
be the one you want to go away from the gingiva?
Tyler, what were you gonna say?
I know like the tips of like their angle. I know they're like their angle tips.
Okay, they can be
I
definitely.
think going for like up and down, like on the side.
Okay. They're a little bit angled, yes. What else is different about them?
We have a triangle tip.
Which ones?
The scalar.
Okay, good. So our scalar has they are triangle tipped, right? So meaning that the top of the tip is sharp, right? So that means that if we go under the gum line with our hand scaler, we're going to cut up our gums, right? So we don't want to use our hand scalers under the gum line. That would be really bad, right? So we use our hand scalers just like on the crown surface, correct? So our curettes, what do we use our curettes for?
Oh, we can go under the gum line.
Right, we go under the gum line to get all that nasty like tartar that's under the gum line and bacteria and grossness under that gum line. So what does the top of our curettes look like?
We can smooth it.
Remember I said they're curved curettes. So rather than being triangle, they're curved curettes. So that's how you can tell the difference. So when you're looking at them, because hand scalers and curettes look really similar, but when you look at them in your packs, the curettes are going to be curved on the top, and then the hand scalers are going to have that sharp edge tip on the top of the hand scaler. Okay. Does that make sense?
Yeah.
Okay.
Do
All right.
we have a quiz for like dental instruments in Moodle?
We might. If not, I'll check.
Okay, cool. I know we have one for surgery one, but I don't remember seeing any for the dental ones. Anyways.
How about elevators? Which one is an elevator?
Big one?
Okay.
The fat end, the big large end.
So this one?
Yeah.
All right. Is there another elevator?
Yes.
Okay. What is
the
that?
other one, the larger tip.
This one?
Yeah.
Yes, this is an elevator as well. Good. Very good.
I feel like the first big one is called a doggy.
This?
Big one, yeah, that one.
So this is probably going to be like your number 3. I'm just guessing on the number size because it's far away, but this just looks like your typical number 3. And then this is like probably a number 1, like for your incisors, like that you'll typically see. And then, so they say the numbers on them, like on the handles, they'll say. So like if your doctor's like, oh, can you get me the number 3 elevator? Then you can be able to grab them for them too. Yeah. And then this is, what is this right here?
That be a suction pole?
Mm-mm.
No.
Is it a bone curette? Or it kind of looks like the peristeel elevator thing.
Yeah, it's a oh gosh. It's an elevator for your periodontal ligament. I was thinking, I'm like going ligament and then trying to think of your ligament here.
Isn't that what your elevators also do?
Mm-hmm.
So that
They're
one,
just all different elevators.
okay. So
Yep.
that one is just a special one where its role is just elevator. No,
Yep.
breaking the periodontal ligament. Is that
Mhm.
right?
So how about our extractors?
Oh, that would be your jaws.
This guy here.
Yeah.
Yeah. Good. All right. So this is just talking about obviously the anesthetic, like what we're actually doing. Here's actually, you could see the curved end right here of that curette. Okay. So it's not pointy on there. Polishing, probing and charting is really important. So we're going around the tooth, but like somewhere about 4 to 6 points around the tooth to be able to make sure that everything looks good. We're looking for any type of mobility, furcation, any depth that, you know, like around the gingiva, of course. Here's how you can see that, you know, there's any type of, so this would be 3 millimeters, right? So we've already put in part of our stuff there, right? And then here, so you see root exposure there, there's root exposure there. So what we do is we take our Explorer and we see, all right, is there any sticking there, like at all? If it's sticky, then we may need to take we need to take an x-ray regardless, but we need to see if we need to remove that tooth. And so this is kind of what our charting should look like, right? Yes.
If I'm looking at if you go back to your other image, I'm just wondering, would that be classified as a treason?
It can be. It depends on how they broke it, like their tooth. This probably would be, but who knows if they broke it some other way, like.
Huh.
Yeah.
I remember working with a golden retriever where he had that because when he was a puppy, he actually chewed on a rock and the owners never actually did anything about it. If owners don't do anything about it, how badly does it affect the animal?
I mean, eventually the root's gonna die, right? But it could get infected, you know, but it may not. But it's gonna be really painful, you know, until that root dies off. So like it's sensitive, right? The root's really sensitive.
So in that case, they might just remove the teeth or do a root canal?
Correct.
Okay.
So I worked one of the the colleges I worked at, we did where we did dentistry on, we worked with a humane society that would take in a lot of like pit bulls and stuff. And there were a lot of fighting rings and stuff in their area. And so when they would bring in the pit bulls, a lot of the pit bulls that came in for dental or dentistry procedures, their teeth were all like down to the nubs, right? I say the nubs. Do you know, so what they do is they just take like their, oh my gosh, they take really big Dremels essentially, and they Dremel down the teeth for fighting rings. And so the dogs are completely awake, right? And they Dremel down the teeth all the way down. So all of those teeth, like there's root exposure essentially. And so we're doing these dental procedures on these dogs that have like literally no crown left on their teeth.
Why would
So-
they Dremel?
Well, if they have no fighting, if they have no teeth to fight, they're being used as bait dogs.
Oh,
Yeah. So yeah, I mean, essentially again, they have like root exposure. So we have to decide at that point, are they still in pain? Is there any type of disease that's going on in those teeth? And we still have to monitor them through like long term if they're going to get infected or not. Like, doesn't mean that we have to remove those teeth right away, but there's a potential down the road that we may have to. So it's pretty sad.
oh, sorry for that tangent. Continue.
No, you're good. So this is how your charting should look like, right? We should be noting like, are there any teeth that are being removed? Were there teeth that were already missing, right? Is there mobility that's in the teeth? And you'll have like a key that says like, you know, how you should be notating it, right? As well. So, but you should have some sort of notation of like what you're actually doing. All right. So taking radiographs, right? So when we take our radiographs, so we want to be able to see, we don't necessarily need to see the crown of the teeth because we can actually see that on our own, but we need to see the whole entire root of the teeth, right? So making sure that we are not foreshadowing or elongating the teeth is really important. We know which teeth are doing like parallel, and we know the degree process of the teeth itself. So whether we're doing our degrees or that you're doing bisecting angle, whatever works best for you guys. So parallel technique, which teeth are parallel technique?
Any of your molars?
Which molars?
Your P3s and P4s?
That's premolar. You're a mandible or a maxilla? Good guess.
Mandible,
No.
then.
It's mandible, right? Okay, so think about when you go to your dentist and they stick the plate all the way in the back of your teeth and you're like wanting to gag, right? They stick it all the way in the back here and you're like, oh my gosh, I can't do this. They're taking rads of the mandible right down here. So they're getting these molars and maybe some of these premolars, as many as they can of bottom here, okay? After that, if they can't get any more, then everything else has to be some sort of bisecting angle, okay? So your mandible molars are your only ones that can be parallel angle. Everything else in the whole mouth is some sort of bisecting angle, right? So with bisecting angle, what you're actually doing is you're taking the tooth root like angle, okay? your film angle, and you are going to bisect that angle in half, or bisect the angle altogether, right? And your beam is going to go basically perpendicular to that bisecting angle, right? So you're going to hit that root right onto that bisecting angle, okay? It gets, like, the easiest ones to do, of course, are always your incisors, right? And the hardest ones are, of course, going to be, I always think, your upper molars, because you have to go where? Through the eye socket, right? You're going right through the eye. So that's the hardest ones, I think. So here's like a really good example. So right here, you have the angle of the plate, right? The angle of the teeth, the roots of the teeth, I should say, right? And then the bisecting angle right there. And so then we're going perpendicular to that bisecting angle to get your actual nice, pretty picture. Make sense?
Yeah.
Awesome. So that's your pretty picture.
Wow, that is a pretty picture.
Yeah. Okay. So, here's your full mouth radiographs, right? Ideally. So even though we're getting our canines in these pictures sometimes, they still don't count, right? Because we're not actually able to see all the time, like, our roots in here. So we do have to take our canines separately, right? So make sure you guys remember that. Okay. So how do we determine on our radiographs which side of the mouth everything is? You know how, like, when you take radiographs, like a chest, you guys have a marker and you put like right side and left side or whatever. How do you do that for dental radiographs?
Our plate has like a little circle, and we just like kind of notate what side the circle is on.
Okay, so where is that circle supposed to be?
Yeah. But we always put it to the back of the mouth as like a rule, just to be like,
Interesting.
just so we know, because we know if the plate is upside, like right side up, then it's going to be on one side. I mean, it's not a great system, but it's just to loosely know where you're going.
Yeah. So I know, and so maybe it depends on, especially digital, on
Definitely it's digital. Yeah.
what like on how they have it. But so you guys see this little pinpoint right here, and you'll see it on all of these little things. There's like a little pinpoint here.
Oh yeah.
Okay. So in order to tell what side of the mouth is, you should always have the dot facing towards the nose. Okay. So, especially in digital, figuring out where that dot actually lives on your plate. So it's not necessarily where the cord is, right? The cord is something completely different, but there is like a dot. That's the marker for your plate. But to figure out where that marker should always be facing on your rads towards the nose, so that you're able to read like what side of the mouth it's on. Yes.
If I'm looking at the middle picture, like the bottom one, I don't seem to see a dot.
Yeah, it might have been because it's on, this might have been just like cut for, like they might have just crossed or cut it out, you know, to make it fit on here nicely, but so they
Mhm.
might have cut it out. But as you can see, like here would be the dot, here would be the dot, here's the dot to face it out of outside of the nose, outside of the nose. Yeah, because I don't see the dot in here either. So they might have just cut some of them out. Here's the dot here. Here's the dot here.
But I'm confused though. So is that the right side or the left side? Like how?
So,
I understand.
so this is the maxilla, right? So this would be the right side. Yeah, the right side of the mouth. The dot, there's no dot here. This is the left side right here because the dot's right here. So right side, right side, right side, front, left side, left side, left side. And then here you have right side, right side, front, right side, right side, but they have the dot in the wrong spot. So yeah, technically that's how you're supposed to do it. Now, especially since we've gone digital, many people haven't done that per se, but that is really, or that is, many have been good about doing that because of the fact that we have like a computer system that puts it all in line really nicely for us. Now, when we had films, because these are actually films, not digital. So we had to like put them on cards and stuff. So we didn't have like digital to be able to put it in nicely. So, okay. So, yeah, so this way we're able to look at it and know, are they left side versus right side just by looking at that dot? We should be able to figure that out. If we don't have that dot, it's hard to be able to tell. Sure, we might be able to figure it out just by looking at it, but it does make it a lot more difficult. And then we're able to see too, like abnormalities, of course, right? So what's root planing? Anybody do root planing or have done root planing?
That kind of like a root canal?
No. So this is for like if you guys have an animal that has a really, really bad like periodontal disease. So where you will curette really, really well. So like a pretty deep curetting. And so down to the roots, like really, really deep curetting. So pretty intense, pretty painful as well. And then afterwards, we typically put like a clindamycin gel in there, or we'll even put like a doxycycline gel. I don't know if anyone's ever used any of those in practice, but that's what root planing is. It's pretty.
Is that what doxyrobe is?
Yeah, absolutely. Yeah. And obviously we use like Doxyrober, the Clindigel like stuff for other things too. Like they'll use it for even like extractions and then put it in there too if like your extraction's really nasty. So, but it's like pretty nice stuff to use. So, but absolutely. Gingioplasty, we'll use that too for a lot of different things. So we'll cut down some of the gingiva for like if you guys have cats who have stomatitis, right? So really bad stomatitis, if we're not going to take out all the teeth, right? Or maybe just kind of like trim down some of the gingiva, just make it a little bit nicer and whatever. And everything. So just kind of trimming down the gingiva. And then again, client education. So discussing anesthetic recovery, pain management. So going over what they can do at home for pain management. What kind of pain management do we do for at home after dental procedures?
You medicate him?
So some type of NSAID, right?
Mm-hmm.
Yeah. Sometimes we'll send home like an opioid if it's like a really bad like dental procedure, right? But a lot of times it's just we need to bring down inflammation and stuff too. So if we're doing some sort of local anesthetic, that's awesome. And then we'll do like an anti-inflammatory, but I mean, it's uncomfortable, right? Like we've done some pretty decent like work in their mouth. So we should probably send home some sort of like anti-inflammatory for a couple of days. So that's good. And then long-term care, right? We're talking about brushing teeth, sure. Diets can be helpful, maybe. Like what about some other diet could be contributing to dental disease?
If I go back to like your medication part, I remember when my dog got his dental, he got sent home with gabapentin.
Mm-hmm.
Is that something that usually
Yeah.
dogs get?
Yeah, so especially if your dog had like extractions, that could be definitely
Mhm.
helpful too, because it's also a pain medication too, that will help with like nerve pain as well. So
And
absolutely.
then
It's
what's
usually,
interesting is that he was a Shih Tzu, so the vet said, "Well, we'll give you Tobrarex, because we're worried that where we remove the teeth that he might get an eye infection because of all the water and the bacteria."
yeah. Yeah.
Which is interesting as well. Sorry.
No, you're good. So diet related wise, it's been said for years that like it could be due to animals who only eat, right, like wet foods. So that owners should feed a hard diet, right? Has anyone ever heard that? You should feed your animals dry food because owners who feed wet canned food, they contribute to dental disease. Does anyone hear that?
Yeah, that's why they're really trying to push for the TD dental diet.
Okay. So that has been kind of shown to like not necessarily be the case, right? Because no matter what they eat, it's not going to really affect like dental disease. Really, there's way more to it, right? Like we personally do not eat dry food and then not have dental disease, right? The really big thing is that we brush our teeth and therefore our dental disease is a lot better. Yeah. So essentially, dry food can still get stuck right there, right? Like if they eat dry food, it's still going to get stuck on those carnassial teeth and the molars, and just as much as wet food. All right. It's not exercising that area or anything like that. It's not breaking up. It is not capable of breaking up that hard calculus. It really isn't. So, nor is TD. TD is tougher to get and it's going to help with like some of that stuff, but TD is not a balanced diet and it's filled with fat. So it's like not a great diet for them to be on long term. So, but it's a good treat, right? So, it's it's one of those things where it's like, yes, it could be helpful, but not the best thing ever. So we still need to consider brushing or doing some sort of like those dental wipes is the best thing that we can do. Treats, you know, any type of chews are really good. They do have, you know, dental treats itself, but we've talked about before last week that some of the dental stuff out there may not be, they're like filled with, again, a lot of like fatty, not necessarily great stuff. And again, can lead to your pet being a little bit, you know, overweight if they're already are overweight. So we consider doing chew toys and stuff like that to be really good alternatives too. And then just keeping up with doing dental care altogether is really good. So, and then I think a really good thing too is like you guys giving your own personal perspective. What do you guys use for your own animals? What are some really great toys that you personally think work well with your animals at home? How do you guys use Kong toys, stuff like that? Like people don't know how to use toys for their animals, you know? So they're like, well, that doesn't work because I don't know how to use it. Tell them how to make these things work. So that is what I have for those. Yes, what were you gonna say?
The other problem too that I find that with owners is that with Kongs or like the toys, you need to train your animal on how to use it. And so oftentimes people just buy it, they expect the animal just to go for it right off the bat, and they go, why is it not working? And then they give up, and then the animal just keeps getting dental disease because they're not doing anything.
Right. Okay, so let's see. When we are talking about oh goodness, when we are talking about, let's see, radiography. What does hypoechoic mean in ultrasound terms?
I mean, that's darker compared to another organ or like another it's either dark gray or white. I don't know. Anybody else? Oh.
I know it's lighter because it's hypo, but I don't know. I think it reflects less light or something, or it picks up less of the waves. But I know it's. I'm not sure either. I just know it's hypo,
so hypo meaning hypoechoic in ultrasound is that it's darker gray than the next thing next, like the other tissue next to it, right? So like your bladder is going to be hypoechoic to your liver, right? Because it's darker color than your liver. Hyperechoic is a lighter color.
Oh, I thought because anechoic was like it's like black, right? Or like really dark? Or no, is that the opposite?
Anechoic would be like, let's see, anechoic without echo. Yeah, so that would be black. Yeah. So I guess essentially, yes, your bladder would be anechoic, but in comparison, yeah, you could say that it's hypoechoic to whatever else too. So okay. Yeah, but yeah, anechoic is without color at all.
Okay.
Yeah. But hypo is less color than something else. Hyperechoic is more color.
Okay.
Yeah, in ultrasound terms, right? So,
okay.
Yeah, I'm confused because when we think about ultrasound colors, we have either or white, gray, or black, right? So when you're saying hypo, that's your dark one, and then, but like your anechoic, like I don't get it when you say more colored, or like
So it's light. So, and now I'm saying ultrasound terms because when we look at x-rays, like our fluid is going to be opposite, right? So like your bladder is going to be white. So that's why I say that. So hyperechoic is going to be light, right? It has more color. Hypo means that it's getting darker, right? Meaning it has lesser light. And then anechoic means there's no light at all. Like it's black.
so completely black.
Yeah.
So
Which,
your hypo would be gray, your hyper would be more white, and then your anechoic would be completely black.
yeah. So what are things that are completely black on your ultrasound? Which we said is your urinary bladder. What else?
Like fluid in the abdomen?
Yeah, like fluid in the abdomen if you see. What else? What is a normal thing that you would see?
Gas.
No, not gas. Gas is white.
So gas would be hyperechoic.
Correct. So what else in your abdomen specifically? It's in your cranial abdomen. I'll say that would be anechoic.
Your
It's typically pretty small.
your pancreas.
No,
Gallbladder.
gallbladder. Yeah,
Gallbladder.
yeah. So like that's one of your landmarks that you look for, right? Is your gallbladder. You like find your gallbladder, and then you can like look at your liver and throw everything else. Because if you
Your-
find your gallbladder, then you're like can start searching for other things, right?
So your gallbladder would be hypoechoic,
Anechoic.
anechoic.
Because you have fluid in there, right? Now, gas is white, right, on your ultrasound, but what is it on your radiographs?
Oh, that's when it's darker. Right?
Yeah, that's when it's
Black.
Okay.
yeah, that's when it's anechoic, right? Because it's opposite.
Because if you look on the outside there's air, so that's black. So if you look in your lungs, it should be black also,
Mm-hmm.
because it's there in the lungs.
Right. Now, when we talk about radiographs as well, say you guys are doing radiographs and want to measure, how do I want to say this? And you are going to do like what is KVP? Really what does KVP do for your radiograph, I should say?
So that's your kilovoltage parameter.
But what is it actually like when we set our KVP, okay, on your radiograph? What is it determining for your radiograph?
The contrast.
Okay, the contrast of what?
So like the penetration of like your patient.
Okay, so it's penetrating, right? Like what your patient is getting, right?
So penetration power energy.
Sure.
That makes sense.
Okay, so, and then what about your MAS? What is MAS?
Milliamperage per second, I believe.
Okay, but what is that doing? Like what is that determining?
So that's the amount of exposure.
exposure
Or
time?
like yeah, exposure time to the X-ray.
Okay, perfect. So the
That's-
KVP is the penetration of like that patient, and then the MAS is the time amount that it's actually going, the X-ray is going to be penetrating, right?
Mhm.
So when our X-ray is completed, right? This is like my horrible X-ray of an animal. Okay, like that's my animal. It's not an animal, I know. So we have our animal here, and depending on our background, right? This is how we're going to determine if what we need to do to our patient, right? So this is where like digital has like helped us so much, because back in the day we had to like retake x-rays like 8 million times, right? So if we set our KVP at say 77, right? And our MAS at, I don't know, 3.2, okay? And say this comes out to light, the background is too light, and this is normal. What do we have to do in order to fix this radiograph? Don't tell me, Melody. I know you know this. So if the KVP is what penetrates the patient, right? And the MAS is the exposure time. How do we fix this? Any ideas?
The light part would be your MES and your normal part would be your KVP.
All right, so how we fix it essentially is our patient, if our patient is normal, abnormal, whatnot, so say something is wrong with our patient, we then need to fix our KVP, okay? If something's wrong with our background, we need to fix our MAS. All right, so that's how we figure that out. So to change that and to know the difference is that we change it by going either up or down. Oops. You go up or down 30 to 50% on our MAS. And then our KVP, you go up or down 10 to 15%. Okay. So think of it like toast, right? So, toast. If your toast is too light, are you going to have to cook your toast more, or are you going to have to decrease your toast?
Cook it more.
Cook it more, right? So our background here, the toast of it, is too light. So are we going to have to go up on our MAS, or are we going to have to go down?
Go up.
Go up, right? So in this sense, we have to retake our radiograph. And so you guys would turn up your MAS at least 30%, okay? So depending on how you guys look at it, if you're like, oh my gosh, that's really, really light, we're gonna have to go up 30%, or you could do 40% and 50%, just depending on how light it is. If it's just like a little too light, then just do 30%. If it's like really, really light, do 50%. Now, say this is changed and you have, this is normal, this looks fine, and this is too dark. What are you gonna do? What are we gonna do if our patient is too dark? What are we gonna do?
So would you decrease the KVP and it's like 10 to 15%?
Absolutely, yeah. So we would decrease our KVP at least 10%, right? So we just take, all right, what's 10% of 77?
7.
Yeah, 7. So you just go down 7. So we would go to at least 70, right? And just turn it down and retake it. If you went down 8, that's totally fine too. You know, it's no big deal. Now, like I said, with digital, it's been so much easier because we haven't had to do it as much to like change it, because digital like corrects a lot of it for us. But there are times where we have to actually like redo them because it's really bad. So does that make sense, everybody? Okay, and now you guys know what KVP and MAS does or is. All right.
So just clarifying something.
Yeah.
The toast is always the background and it's not the patient.
It
Like-
is both.
Okay.
So it just,
So-
I think of toast as, okay, if my patient is too dark, I'm going to think of it as toast, right? Like if it's too dark, I have toasted my patient too much, right? So I'm going to have to lighten them up versus, you know, so.
That's very helpful because I've been trying to figure out like the whole KVP versus MS thing and which one to change has been really, but I've never heard it so simplified. So thank you for that.
You have to think of it as like, I guess that's how we did it back in the day. We were always like, oh, think of it like toast, because we always had to do it over and over again, you know. It sucked.
Yeah.
But now that digital is there, it just has made life so much easier. Okay, so
Hey, Beth.
yeah.
So I have a question, but it's not super off topic, but it's a little off topic. Okay. So my clinic is a newer clinic and they don't have dosimeter badges. Is that legal?
What state are you in?
Missouri.
Pretty sure you need them in Missouri.
Okay, I tried to Google it, but I like couldn't figure out, but it kind of stressed me out.
Yeah, I'm pretty sure you do need that in Missouri. I would look through OSHA stuff. And then yeah, like they should have them for you guys. Yeah.
Okay.
That's interesting.
Yeah, I'm their only like tech person who's gone through school, so the other girls don't really know it's their first vet jobs. But like I came from a different clinic and I went through school, so when I saw that I got like really stressed.
Yeah, no, absolutely. I mean, it's such a good idea because, you know, right, yes, like the chances that, you know, you're in a general practice and you're going to be like overexposed is not that great, right? But we should know, especially in our sake, like lifetime wise, we need to know like how much we're actually being exposed to radiation and stuff too. So I would just say like they need to be providing you guys with appropriate protective equipment, and that includes dosimeter badges. That's one of the OSHA regulations typically, and I know Missouri's typically pretty good about that with having those OSHA stuff. So I'll actually check into that because I'm pretty sure that my Missouri practices always had that. So because Missouri was one of my states too, so that I went to. Okay, so what is the universal digital format system that we use that holds our electronic images where we can send them to other practices and such? What is it called?
DICOM.
DICOM, very good, very good. And then, let's see. So, oh, okay. Radiographs are produced within the X-ray tube using the cathode and the anode. So what is the cathode in charging and what is the anode in charge?
The cathode is a negative charge and the anode is a positive.
Very good. So how do you guys remember cathode and anode in charging?
Arnold
I
is
think
a dog. Kathy's a pissed off cat.
Cathode is, yeah, cats are negative, right? Yes, good. So yeah, just thinking of cats being very negative. Not all cats are negative, but we just think of it that way. And so then the anode could be positive, right? So, or just thinking of like anode A+, yay, positive. Okay, so which of the following, so there's, I should say, the big three things that help us with radiation protection. What are those big three things that we need to consider? Like from Alara's principles.
time, distance, and shielding.
Time, distance, and shielding. You guys should be able to say those three things in your sleep, right? Like super, super good. So time being like what?
Like the time your MAS
Yeah.
that you're taking the radiograph.
Right. And then how about distance? What does that mean?
How far you are from your patient
Yeah.
and from the machine.
Right, right. So how far we can stay away from the primary beam, right?
Mm-hmm.
So, or get scattered too, yeah. So like, how do we distance ourselves? Anyone distance yourselves from your patients?
Idea if our patient's like anesthetized, but sometimes you don't really get to.
Yeah, it can be difficult, right? Anyone live in New York? Nobody? So New York, they have to do hands-free radiography. Oh my gosh, hands-free radiography. And I know in like New Jersey, they're doing it too. So how do you do a hands-free radiography on all your patients? Crazy, right?
You don't.
You don't.
Sedation.
Not all sedation, not all.
Bags, tape.
So there's a lot of like sandbags, tape, yeah, a lot of that, right? And yeah, you really do the best you can. And there is more sedation, yes. But it really is, it takes a little bit more time, right? But it actually is not allowed, you're not allowed to be holding your patient. You're not, it has to be hands-free. So I actually saw, like, I was in New Jersey and I saw them do hands-free radiography on a Rottweiler who was not anesthetized or anything. And he had sandbags and white tape and they taped him down and did 3-view chest rads on him. And I was like, that's amazing. Like, absolutely amazing. So there's a video on hands-free radiography for you guys that I posted too. So FYI. Are you in, Lisa, are you in New York?
I am actually.
And you said they don't?
No, in practice they don't.
Really?
No.
But they're supposed to, right?
Yes, but I wouldn't say that they don't always, like they go out of their way, but especially in emergency,
Oh yeah.
I'm gonna say no.
Yeah.
Not all the time.
Yeah.
We do use a lot of sandbags and a lot of tape and a lot of sedation. We do all of those things.
Yeah.
But I won't tell you 100% of the time that it doesn't happen that way. Definitely doesn't.
I can say I can probably understand, I guess, like in emergency situations that can be hard, you know, to do.
Usually when it's fast paced and you're moving and you have a critical patient or a patient that is like in a physical state where sedation could compromise them even more, or sandbags, you know, maybe they can't breathe.
Right.
Sandbags are an option. You know, you have to consider the where the patient is at as well.
Yeah, or you have limited time with them out of oxygen or something to that effect or whatever. You know, they're already struggling as it is. So yeah, no, that's understandable. So yeah, you're doing the best you can.
In GP as much
Right.
recently. Maybe they get a little more luxury when it's like hip x-rays or, you know, something, you know, not that's more casual where the patient's there for a full day or for a drop-off period.
Yeah.
Then maybe yes.
Yeah. Yeah. I mean, it would be ideal, right? Like if we could all do that or get better at it, like that's what I would love to just at least learn more about it so that we could get better at it. Because yes, like safety wise, I think for all of us long term is going to be really great. But I mean, I was pretty impressed, like that they were actually able to do it. Now, I will tell you, this was at a specialty practice and they had a lot more staff. So I think that was also really helpful. So.
I think my daughter's now in tech school and she works in practice, and I do always tell her, like back in when I was starting in the field, you know, similarly, I started in a practice where they didn't take a lot of time to keep safety in mind with radiology. Just wasn't there. And I don't think that a lot of people that go in without training from school understand the dangers of what they're doing when they're like, oh, just hold this animal.
Yeah.
You shouldn't be doing that. And so, you know, going in with that mindset, like I do tell her, if anybody asks you to do this, just for no, like say no, because you're not supposed to.
Right. Absolutely. Absolutely.
It's something that, you know, I agree with you where we do need to get much better at that. Or if they're in there with strictly following protocols with safety gear and
yeah, absolutely. So one of the answers that I had in here was also age, right? So what age are you allowed to actually help with radiographs? Is there an age limit?
18.
Okay.
At least 18.
You don't sound very sure.
No, you should be.
Yeah, to be at least 18.
Yeah, you have to be at least 18, right? So I will tell you, on my 18th birthday, because I started in the field when I was 16, on my 18th birthday, my coworkers came to my house. They found where I lived. And they decorated my car and were like, congratulations, you're able to help us with x-rays now. Like they were super excited. And then they like decorated the x-ray machine when I like, you know, was at work and all this stuff because they were just like so thrilled that I'd be able to help with helping with radiographs and stuff. Because prior to that, all I ever did with radiographs was like develop them because we had, you know, old developing of radiographs. We didn't have digital at that point. So, yeah, but I always felt bad. Like I couldn't help with radiographs because I was too young. So yeah, but yeah, they have to be at least 18. So that's another thing is that like knowing those things too, because that's again OSHA as well, you know. And then so our third thing, so we had time, distance, and shielding. So shielding wise, what are the important things about shielding? What does shielding mean?
Protect yourself and hide.
Okay, so hiding with what?
Like if you're able to do hands-free radiography, get out of the room.
Okay.
or
You can
pressing
get out of the
pedal.
room or
You can wear like your protective gear, so like your gloves and your thyroid shield and your big gown.
okay.
Your lead devices, your lead protection equipment that
Right.
you x-ray every 6 months.
Great. Perfect. So yeah, your gown, thyroid shield, gloves, and what's our other thing that we should start wearing, especially?
Glasses.
And our lead glasses, ideally, because we want to protect our eyes from like cataracts and other things. So that's like our next new step is lead glasses. They're super cool, guys. Come on now. They're not, but you know, whatever. Now, how many of you guys wear your lead gloves every single time? Every single time. Right. So that's going to be the goal, right? The goal is, hey, let's find gloves that are like usable so that we wear every single time, because all of us who have worked in the field, I guess Lisa probably could say too, right? We didn't wear thyroid shields for like the longest time when we first started in the field. And then a bunch of people.
I don't think the practice even had one.
Right. And so then people in our field started coming up with like thyroid carcinoma or thyroid issues altogether. So like now what's going to happen when we don't wear our gloves? Like, sure, some of the older machines, they could be kind of dangerous, you know, like with the amount of radiation exposure, you know. And if you see some radiation exposure altogether, like it's pretty gnarly with hands and stuff. So yes, if you put, also your gloves do not protect you when you have your hands in the primary beam. So keep that in mind. So don't put your hands in the primary beam even with your gloves. They only protect it with scatter radiation. But that's really important, is to keep your hands protected. I personally like the like little mitten ones that are like the Bloxar ones that are not, they're not lead, but they have like a chemical in it, but they're lighter on the hands. So I can take my hand and push my hand out and grab like the paw and then bring the paw back into the glove. And then it protects myself and then maybe the little paw of the animal, right? But that way I'm protecting it, right? So make sure you do your best at wearing those gloves and telling the person in the room with you, hey, put your gloves on. You know, we're gonna be good people and wear our gloves. But yeah, it's like, it's hard, I know, but you need to do it. Okay. Any other questions that you guys have at this point?
When people, like, I don't ever do this because I just don't trust it, but like when they put their hand underneath their gown, is that fine? I tell them no, but they still do it.
They put their hands underneath their gown.
Yeah, like they just like slip it under like where their belly is. Like they have one hand on the patient and then just, you know,
the other hand is under their gown.
Either that or behind their back is what they do.
I mean, I guess so, but at the same time, their other hand is going to be exposed.
Yeah.
So.
No, like they're wearing a glove on the hand that's on the patient.
Oh,
but, like,
okay.
their free hand is either behind their back or under their gown.
Yeah.
So.
I mean, that just seems silly. Just put the other glove on.
I know. It's just when they have to do it super fast. But yeah. No, I know. Like take it a second, but yeah, it's a timing thing for sure.
I mean, I guess that would be okay. Like, especially if it's under the gown, I guess it would be okay. It's weird that, because technically it could essentially, depending on where their hand is behind their back, maybe there's still that possibility that it could scatter and go behind. But yeah, I think, yes, the safest option is putting on a glove, you know?
Yeah.
So, that's interesting. I have not seen people do that.
Yeah, we do things weirdly. Correct.
Yeah, interesting. No, this, all right then. All right, any other questions you guys have?
I have a terminology question.
Okay.
I keep forgetting what the word deciduous teeth means. So I'm like, is there an acronym or like, what do you guys use to remember what this word means in different species?
So deciduous teeth. Okay, so I mean, I don't know how I just remember it, but what does deciduous teeth mean to anyone?
I mean, there
It's
are
like their
some
baby
diseases like
teeth
deciduous
for their
teeth.
first ones.
So sorry. What I had two people talking at once. Sorry.
They can go.
Allie, you were saying something?
Oh, I just said it's like their baby teeth or their first set of teeth.
Okay. So their first set of teeth. And then Emily, what did you say?
I was just saying there's such a thing as like deciduous trees, I think. So it's kind of like, if that helps at all, I don't know why it would, but maybe like those are like
Yeah.
out of the ground.
No,
Like,
you're right. You're right. It's deciduous plant or deciduous. Yeah.
yeah.
And then they fall off. Yeah, it like falls off into the own maturity. You're absolutely right. Yeah.
So what about like your deciduous teeth in your horses? Because horses just confuse me because I don't know. Their tooth process is so complicated. I can never remember what is what and how that works.
Oh gosh.
Do any of you have horses or work with horses or
this is something.
What was your question? Sorry.
so as far as like equine dentistry, personally I always have a hard time remembering like their process of like because you can tell their age based on like their
Oh
teeth.
yes. Okay. Now I know what you're talking about. All right.
So
I'm like, what are you talking about? Okay.
yeah, and I'm not a horse person. I'm learning about horses, but yeah, I don't do much with them.
So they're firstborn, they have 24 deciduous teeth. Okay, so they're like first primary teeth. They have 24. And then you're right, depending on their age, they continue to get teeth as they age, right?
Mhm.
So like a mature horse will end up getting somewhere between like 40 to 44 teeth. So just kind of depending.
What's about like I keep seeing things about star. There's like a star on their tooth. Does that make sense?
Star on the teeth.
Like there's like a mark of some sort on their tooth. For some reason, I feel like it's a star or something.
I'm just trying to, oh, like an enamel spot it's saying, that's all. So it's saying that it appears at 8 years of age for horses.
So they get that star at 8 years.
Mm-hmm.
And then they end up, so they start out their life with 24 teeth, and then they kind of have them and grow until they're like 44. Yeah, 44.
So yeah, it says like stallions get like 44 teeth essentially. Mares can have somewhere between 36 to 40 teeth. But again, like they continue to grow as they age. So that's how you can count their teeth to figure out roughly like how old they are.
Mm. Cool.
So yeah, they get that dental scar like as the tooth wears down on their incisors.
Cool. I don't know what
I'm like, you're throwing me for a loop here with this large animal stuff. It's making me have to dig deep into my brain here. Really rough. Really, really rough.
And for, might get mad at me, Beth, because you're like, you're supposed to know this by now. But the canine tooth, how do you guys remember what number that canine tooth is?
In a horse?
Or like, either in a horse or in a dog. I've seen those questions in like books before and they didn't have the answers. And I was like, ah. So,
You said canines were always 4s, right?
Mm-hmm.
That's all I got.
So what would be your canine teeth in a horse then?
I keep thinking of the wolf tooth.
Yeah. So your canine teeth in a horse is going to be still your 4s, 104, 204, 304, 404. If they have the wolf tooth, that's going to be a like 105, 106, or I'm sorry, 105, 205, 305, 405. And then like premolars or molars then go from there, like counting. But yes, you're thinking of wolf's tooth. I thought you were probably going that route, but I was like, we'll see where we go.
So like, okay, so if our dog canine is always a 4,
Mm-hmm.
then our
So our
equine-
cat, dog, equine, always
everything's 4.
4. Then what about molar?
9?
9.
No.
Yep.
Canine is always 4 and molar is always 9.
Correct.
No matter what the animal is?
Yep.
Cool.
Look at that. Thank you, Stephanie.
Nice.
I like this kind of chart because it has the colors, just like the dog and the cat one.
Yeah.
Your molar is.
So I would just read that and just kind of study that. That's what I'm gonna do.
Right. And it says like when present, because remember, not all of them have it.
I don't know how to, it says like stop share. I don't know if I should just leave that there.
I
If
don't
you guys
care.
are able to save. If somebody needs to save it, they can.
This is super helpful. Thank you guys.
Oh, and this picture is like really easy to find. It's like the first thing when you Google it.
And it's funny because I know this stuff. It's just a matter of reviewing it and having it stick. Okay, so we said canine. Canine is always 4, molar is always 9. Cool. I think I got it.
Perfect. All right. Any other questions? Awesome. Great job, guys. Thanks for sharing your screen. I like that. Great. All right. Well, you guys have a great rest of your weekend. Enjoy the extra hour today that you have. My husband already said he likes the fact we have 25 hours today. So you guys, I'll see you next week. So keep working hard. And yeah, I'll see you next Sunday. All right.
Thank you.
Yeah, take care, guys. Bye.
Bye.
Thank you.
Sure. Bye.